How did doctors treat osteoporosis spinal fractures in the past? In earlier times, treating osteoporosis-related spinal fractures mainly focused on easing pain and supporting the body's natural healing. Doctors usually recommended rest to give the fractured vertebra time to recover. Patients were advised to avoid heavy lifting and strenuous activities for several weeks to prevent worsening the injury. Pain relief was a key part of treatment, often with over-the-counter medications like non-steroidal anti-inflammatory drugs, which helped reduce inflammation and discomfort. If pain was more severe, doctors might prescribe stronger pain medications, but opioids were used cautiously due to their risks. To stabilize the spine and limb movement, doctors used braces or corsets. These devices helped support the fractured area, decreased pain, and prevented further injury. Bracing was typically worn for a few weeks to months, depending on the severity of the fracture. During this period, physical activity was limited, but gentle movement was encouraged once the pain started to subside. Physical therapy was sometimes introduced later to help restore mobility, strength, and flexibility. In the early days, there were no surgical options specifically aimed at fixing the fractured vertebra directly. Instead, the focus was on managing symptoms and allowing the body to heal naturally. Surgery was considered only in complicated cases where nerve compression or deformity caused significant problems. Such surgeries might include spinal fusion or stabilization procedures, but these were less common and often reserved for severe cases. As understanding of osteoporosis grew, doctors began to realize that preventing future fractures was just as important as treating the current one. This led to the use of calcium and vitamin D supplements to support bone health. Later, medications like bisphosphonates were introduced to slow bone loss and reduce the risk of new fractures. These treatments marked a shift toward not only managing fractures but also addressing the underlying disease. Overall, past treatment relied heavily on rest, pain management, and supportive devices, with surgery reserved for complex cases. As medical knowledge advanced, emphasis shifted toward both symptom relief and preventing future fractures through medications and lifestyle changes. It's always best to consult healthcare professionals for personalized care, especially with osteoporosis, as each case can vary widely.